city, eh, I sometimes am peeved to hear that, crime is down, crime is down, crime is down. I know that our local officials are, unfortunately, a violent term, at war with federal officials. And so I know that we want to paint the picture that crime is down, but if one youth dies in this city, that is enough to invest and change, uh, what we're investing in. And so I'm begging our city to consider public health as an approach. Public health identifies a problem like cancer or a car accident, and then identifies the risk factors and protective factors. We've done that. The public, CDC has done that for gun violence and for youth violence. We have the problem, youth violence, which spreads through risk factors, and can be protected through protective factors. And then we can implement programming such as Trigger University, or Guns Down Fridays, or Safe Spaces with Crowns, or Wham Wednesdays with Trap. We can do art healing with Trayvon Center. We have programming to really uh, check off the box for the stage three of a public health approach. And then the last approach of public health is to scale it. And that's where our city's failing. We haven't been able to invest in programs that work. We have CBT, which is cognitive behavior theory with violence interruption. That's coined as an evidence-informed approach, but youth development and positive youth development works to prevent gun violence. And we just don't have the same attention and the same regard. And so youth are suffering in silence, and they did that through the pandemic, and they're still doing that now. Babies that were just born in the pandemic, like my son, are now starting kindergarten. And then vice versa. If you were 5, now you're 10. If you were 10, now you're 15. And those are critical stages of youth development. That's when you're developing hope and autonomy and identity. And those things cannot be developed easily just by what you say to do. People have to model, healthy relationships and healthy communication. And, for a long time, we've had city leaders uh, fight, on TV and in public, and spread violence in that regard. We've had some very heated candidate discussions. So our adults are not modeling what the youth should be doing. And we're asking them and blaming them to do what we think they should be doing. So I do not think the pandemic was appropriately addressed. And now we see higher rates of suicide in our city. We see higher rates of youth violence. We just lost two young boys who should be here, who were on their paths of prevention, who were playing football, who were good siblings and good young community leaders already. Milo and Tyel should be here. But the problem is, Guns Down Friday or Trigger Project, the DC Youth Violence Prevention Coalition, our phone doesn't ring until after a young person's gone. And then even after we lose a 10-year-old, a 12-year-old, and a 14-year-old, we now lose an 18-year-old. So 3 youth have been killed this month, and the city isn't in an outrage, nor is the city jumping behind Youth Violence Prevention Week to elevate the babies that are still having to survive this and push through it. There's just Youth are only met with blame and misunderstanding, and that's the crime.